I bring that up? Because we're talking about coffee and your heart.
That's right.
Joining us to talk about the impact of coffee consumption, Fox5 medical contributor, Dr. Richard Chaffoo.
Yeah. Hi, thank you for joining us.
Good to be here.
You know what, there have been a lot of studies on coffee, and we've all read them, good or bad. But the New England Journal of Medicine found that coffee consumption, again, can be good and bad. Does that just depend on the individual? And can you talk about the study a little?
It does, really, Maria. A lot of this in this study was done. They took basically 100 participants, men and women. They allowed them to have whatever coffee consumption they wanted to have over a 2-week period, and they found in the end that there were 2 factors that they saw. There was an increase in activity level, not surprising, more caffeine. We're going to probably, I think it said 1,000 steps more a day. And then also the issues are going to be issues related to palpitations or cardiac changes, and that's a bit worrisome when you think of that as a concept. But the truth being that we're seeing what are considered 2 types of issues in terms of arrhythmias. One is called PACs, and that's the atrium, the upper chamber of the heart, having premature contractions, and then the ventricle, the lower part, PVCs, which tend to be a little bit more malignant or concerning. But despite that, although they saw an increase of 50% increase in PVCs, premature ventricular contractions, they really didn't find that those were malignant. In other words, they didn't seem to cause any damage to people.
Do they find, sorry for interrupting,
yes,
do they find like a link for somebody who had 5 cups a day versus 1 cup a day, that sort of thing?
Not a direct link,
yeah.
But there's certainly, there would be a connection. And the obvious thing, we saw a diminished sleep. People averaged 30 minutes less of sleep that were in this study that drank.
Which would make sense. People drink a lot of coffee.
Right.
And also, yeah, that does make sense. But also there is a link between lack of sleep and heart issues. So yes. I guess, does it really depend on how much you're drinking? I guess really that's the issue.
I think that's part of the point, Maria. There's probably longitudinal changes. We know cardiologists will say if you have some underlying heart disorder, certainly if you're hypertensive, if you have a history of arrhythmias, you're under the care of a cardiologist, you want to be cautious in terms of how much caffeine you take, because certainly we've seen more caffeine can raise our diastolic, which is a more concerning number, and our systolic, the upper number. And although that's a temporary thing in you and I that are not hypertensive, it can be an issue for people that are hypertensive and are taking antihypertensive medications, much as if these PVCs that can occur in all of us which have normal contractivity and normal conductivity in our heart. If someone has an underlying arrhythmia, has an underlying propensity, then that can be more significant. And the higher the dose, certainly it could be more of an issue.
Let's talk about the science of coffee itself a little bit, because when we have these kinds of studies, what's in the coffee and what exactly is it doing to you? Or are we just talking about caffeine here?
We're really talking about the caffeine,
yeah.
Andrew. That's the major issue. There are some other conflicting studies that say coffee prolongs your life, makes you more healthy, and some researchers are suggesting that it may have something to do with the antioxidants because it reduces the inflammatory process, which we all know is part of the aging process. But again, I think the important thing to remember that many of these studies are epidemiological studies, and they're not really well-controlled, prospective, double-blinded studies that are really the ones that we consider in medicine the gold standard.
Is all caffeine the same? I mean, like if you have it in coffee, if you have it in soda, if you have it in something else?
It's different concentrations. So an average cup of coffee has about 94 to 95 milligrams of caffeine. Tea about half that amount. But there are these energy drinks that have huge amounts of caffeine. Megan and I were just talking about this before we came on the air, and they can be significant.
So there are real physiological effects, but it really, I guess what it's saying then again is it really depends on how much you're drinking and also who you are, like in your health issues.
And what's our underlying health status? Obviously it's going to be more dangerous in the extremes of age and underlying health issues. But if your cardiovascular system is intact, your overall general health is good, drinking a few cups of coffee a day, at least from this study and others, indicates there's no significant deleterious health effect, either to our contractility, to our blood pressure, or the risk of coronary artery disease or stroke. And that's what I think people are worried about.
Yeah, I was going to say, bottom line, good, bad, coffee. I mean, does it really have a conclusion here, or you just, we kind of not?
We don't know yet.
Hard to say.
We don't know.
Moderation, maybe?
Moderation is in everything, right? So,
always.
If you love coffee, maybe some decaffeinated might be a good idea, or limiting the amount that you have, being really careful with energy drinks, which are loaded with caffeine.
Yeah. That can be,
depends on your health.
Yes.
Depends on who you are and your health.
All right. Dr. Chaffoo, thank you so much for the insight.
Sure.
Thank you so much.